Gilbert Hospital and Florence at Anthem Hospitals. I'm Dr. Ann Borik, board certified in internal medicine, and I'm here to keep you up to date on the latest information pertaining to your health and well-being. Welcome to DocTalk Radio, sponsored by Gilbert ER and Florence Hospital at Anthem. Boy, I can't believe I made it today.
Man, I'll tell you what, me neither. I've had no energy at all.
You know, it's been so busy with this flu epidemic, and the hospitals are full, and there's just so much that I want to talk about today. For those of you listening, I invite you to call in, join the conversation, 480-745-1033. Joe, how are you? How are you doing today?
You know, I'm feeling pretty good right now, but I wake up and I'll tell you, I just want to lay there for a week.
Really? Well, good. Maybe we can talk a little bit about fatigue and some of the things that we can do. But you know, I want to kind of share with our audience out there an update on the flu and the epidemic and everything that's going on. I don't know, but you know, this time of the year, this is the flu season year, and we're right in the middle of it, and it's really turning out to be a pretty, high flu season, actually. A couple questions that I got that I want to share with our listeners. One of my patients asked me and said, I got a flu shot early in the season, like September, early October, and would it be worthwhile getting another, like a booster shot? And that's a great question, because a lot of times when you think about it, a flu shot is really intended to boost your immune system. The question is, does it last the entire season? And what we recommended, and after really talking and consulting with our infection disease specialist and really, kind of identifying what the right answer to that question is, we decided that in a patient population, some of our patients who, for example, have diabetes, who have renal failure on dialysis, at a very high risk for complications due to the flu, to the influenza, we actually do recommend, if on a patient-by-patient individual basis, if you want to get re-injected with the flu shot, that's not a bad idea, especially if you got it early in September, early October. The question is, how long does the flu shot last? And for me personally, I oftentimes wait to get the flu shot until November, because if you think about it, the physiology of the flu shot really is intended. It's not a live virus, but it is intended to boost your immune system, cause your body to develop antibodies, so that if you do get exposed to the 3 most common viruses of the season, your body will be able to fight it. So you're really just boosting and strengthening your immune system against those particular viruses. And the flu season really lasts, particularly around here in Arizona, through April, sometimes even into the first week of May.
That's huge.
It is. And so, when you think about your immune system, usually we say, well, the immunizations should last about 6 months or so. But for the elderly population, if you have underlying, risk factors, immunocompromised state, it's a good idea to probably talk to your doctor and see, is it worthwhile considering, another flu shot? So that was a question that I wanted to share. Joe, I got a call. It was really interesting this past week. Red Eye Radio. I don't know if our listeners have ever heard of Red Eye Radio, but it's a really an interesting venue where they're on the air. It's a radio show that really reaches out. It's a syndicate that, according to their website, they reach out to over 200 stations. Well, they contacted me this week and asked if I would do a live interview with them. And we talked about the pros and the cons of the flu shot, and so it was just a really fun thing. And interestingly, these guys I believe they broadcast out of Texas, or tuned into DocTalk Radio, and it was really an interesting kind of a phone call that I got, and I was very excited to do that, and so maybe in the future we can connect with Red Eye Radio and do some more shows. And I'll tell you,
I learned something on there too. I heard when you were on there and you were saying that you wait to get your flu shot, kind of, towards a few months into it.
Right.
Which I never even thought of that. I thought you had to get it way before,
right.
But that makes a lot of sense.
Yeah, so that was kind of an interesting conversation. I don't know, Joe, do we have any calls? I have a lot of stuff that I want to share with our listeners today.
I'm just throwing this right on to just one more post here, and then we'll start to get some calls. As
we get into it, I want to just share just a few things that I've had with my patients just this past week. Very, very interesting case. I had a lady come into the hospital who kept passing out. And, what happened was early on, probably about a month or so ago, she had a syncopal episode and passed out. went in, got seen, everything was fine, was treated. Really, not a whole lot was done at that time. She was at one of the other hospitals downtown, and lives out in this area. I guess she was visiting with her daughter out that way. But in any case, she came in, and every time she stands up, she passed out. It was going on for about a week or so. She didn't really want to, go back to the doc. She didn't want to really do anything. She has a history of some underlying kidney problems, and she decided that she wanted to wait until she saw her kidney doctor, because she thought that maybe these passing out episodes may have been due to, her kidney, which had been chronic for a long time. The morning that she was getting ready to go to her kidney doctor appointment, she had gotten up, was getting ready, and she passed out. So her daughter brought her into our place. The message, and what I want to talk about, is something called orthostatic hypotension. And when people have fainting spells, for example, passing out episodes dependent on posture. For example, if you're lying down and when you change position to stand up, sit up, stand up, and you pass out, the passing out spell basically is due to, most likely, changes in the blood pressure. That's what we call orthostatic hypotension. And most commonly, it's in people who are dehydrated, people that have had a history of an illness that you can uncover, nausea, vomiting, gastrointestinal, flu bug, that kind of thing, where they just become dehydrated, and when you stand up, you just feel kind of lightheaded and you pass out. Well, in a subpopulation of people, there is something called autonomic dysfunction. And I just want to kind of talk a little bit about that, because it's a really interesting pathophysiology. What happens in our blood vessels and the vasculature in our body is that there's continual checks and balances going on from the neurologic system. For example, if we drink too much fluids, the body can accommodate. We can expand the vasculature, we can accommodate, we constrict down. That happens automatically. In people who have a dysfunction of the nervous system controlling the vessels in the body, what happens is, at times when that change, for example, that constriction that should happen doesn't happen, or if it dilates when it shouldn't, we end up developing low blood pressure or high blood pressure and result in passing out spells. So it's called autonomic dysfunction, and oftentimes we see it in associated with some other problems. Like, for example, people who have Parkinson's, for example, can develop what's called a Shy-Drager syndrome, where the autonomic control of the blood vessel is, for whatever, not working appropriately. And so that's something. People who have, for example, diabetic retinopathy, diabetic neuropathy, sometimes that can occur. So just wanted to kind of throw that out there and just, let people know that if somebody passes out, most of the time it's a benign situation. Fainting is not uncommon. But on occasion, if it happens time and time and time again, and every time you stand up, you pass out, that could be a pretty serious thing. However, it's easily treated once the diagnosis is made. And I guess that's my point, is that we need to make the diagnosis in order to treat it, because once we make that diagnosis, what we recommend is what's called a mineralocorticoid, which is a type of a steroid. It's a hormone that oftentimes is lacking in the body, and very, very low dose. We use it, and it really is within 6 to 8 hours. We replace that mineralocorticoid in the body, and the blood pressure tends to stabilize. And so it's kind of like a deficiency, and it's amazing. And so that was kind of what we did, and it worked out, fantastic, and the patient did very, very well. So that's just something that I wanted to put out there. There's some new literature, a lot of research that's coming out, and I wanted to just talk about a recall. For those of you listening, I wrote down some information here. There's an oxygen device. People who are on home oxygen, there's a device by Fisher-Pankel that is recalled. And I just want to, it actually is called the oxygen device by Fisher and Pankel, Pankel, distributed anytime this past year between August and October. They're recalling it because there's a faulty, leaky tube that is affiliated and associated with this oxygen device, and the FDA has put this alert out to recall these. And so if it is something that, as a listener, by chance, if you're on HOMO2, that maybe you just recently got a device and it happens to be a Fisher-Pankel, I would look into it and talk to your doctor. Joe, do you have some questions there?
I do. We've got our first one, Shelley from Gilbert, and I just want to say hello to everyone out there on the chat as well. Shelley from Gilbert, 54-year-old female in good health. She says, I am a smoker. I've had a flu shot, and I am really down right now with the flu. What about the pneumonia shot, and why have I gotten this?
Okay. Great question. Let me just explain. First of all, you are absolutely the perfect candidate for a flu shot, so I'm glad that you got it. As a smoker, that puts you in the category of really, requiring a flu shot. The flu shot protects you against the 3 most common viruses of the season, the type of viruses that potentially can be life-threatening. Now, there's hundreds of viruses out there, and most likely you probably have, a virus bug that, you'll get over, and it's probably, self-limiting. There's really not a whole lot to do about it. But just because we get the flu shot does not mean that we're not going to get sick in the season. And that's very, very important to understand. Influenza virus carries a very high mortality. I mean, people die from influenza virus. So that's why we recommend the flu shot, to protect you against that most deadly influenza that potentially can lead to a high mortality, and medical problems that can lead to death. The flu that we just use loosely, the flu of virus, the coronavirus, the rhinovirus, that's pretty much just your garden variety virus that's there all year round. More prominent at this time of the year, just for many reasons. But the flu shot is not going to protect you against the 200 plus viruses that are out there. That's why we recommend doing everything possible to boost your immune system. Get rest. Sleep is so important to keep the immune system strong. Eat a well-balanced diet. Vitamin C this time of year is probably a very, very good idea. Smoking, unfortunately, tends to break down the immune system. And so the fact that you're a smoker is going to put you at a higher risk right out of the gate. And what it does is it actually, how it affects the immune system is that it really decreases the effects that vitamin C and other antioxidants in the body, how that protects your body, it decreases, it blunts the effect of that, or the protective effect. So the best thing that you can do, Shelley, is, cut back on smoking, get lots of rest, take, lots of fluids, keep yourself hydrated. And, if you end up developing a gastroenteritis where you can't keep fluids down and become nauseated and vomiting and diarrhea, that's when you want to seek maybe emergency, go to the ER, call your doc, because, you don't want to sit around dehydrated on top of, this illness. And I think that's the biggest thing. Coughing is a huge problem. We're seeing people with this croupy, chronic cough that's lasting for 4, 5, 6 weeks this season. Again, it's the residual effect of the flu bug. It's not necessarily the influenza, mortality, virus, but nonetheless, it is very nagging, and it can make you exhausted. It's exhausting, to be coughing and you don't feel well, and fevers and chills and all of that. So there's not a whole lot to do, other than if you come down with these symptoms within 24 hours, we have something called Tamiflu, which is an antiviral medicine that has been found to help decrease the viral shedding in the body, which will like shorten the actual duration of your virus illness, of the viral illness. So for me, for example, when I feel, and I have this in my house like every season.
Is this an over-the-counter?
It's a prescription. It's called Tamiflu. It's recommended to be given twice a day. It is what we treat influenza virus with. So it's an antiviral. The problem is that the only time that it is really effective and when it's indicated to be used is if the symptoms start within 24 hours of you getting the medication, starting the medicine within 24 hours. So that's why if you start feeling ill, give your doctor a call, see if it's something that might be worth, considering or taking. Other than that, there's not a whole lot more to do.
Injections, is that what they are?
It's a pill.
Oh.
It's a pill. And as soon as you start feeling sick, for me, I start it. Because, it really, according to the literature, according to research, it helps to decrease viral shedding. Does it prevent it? No. It doesn't prevent it, but it's going to help to kind of keep you, standing upright and out of bed, and,
right.
and the severity
right.
of the illness may be blunted a little bit. And I think that's important. Do you have more questions there, Joe?
We do. This is a little off the subject, but Franny from Phoenix called in. She says, I have noticed a lump on my left breast under the skin like a marble. Doesn't hurt. I noticed it right before my last 2 periods ago. Sorry. It's been 2 months.
Okay. I don't know. How old is Franny? Did we say?
Didn't say.
Okay. This is an opportunity that I think the purpose for DocTalk Radio is to give sound medical advice. And this is one of those times that Franny, I want you to hear clearly what I'm going to tell you. Anytime that a lump is felt in the breast, if it's non-tender, if it's there over 1 or 2 periods, it's worth getting checked out, period. I don't like messing with the possibility of without knowing exactly what we're dealing with. So my recommendation is, as soon as the show is over or even before the show is over, do what you need to do, call, get in to see your doc, get a mammogram, maybe an ultrasound would be the best way to go. And get it checked out, because we know that breast cancer, when it's found early, is absolutely curable, just like any other colon cancer and those kinds of things. So it makes no sense to wait and not get it checked out. That's just my advice to you.
And Rick out there says, please tell the doc to tell us the story about the guy passing out on the bus.
Oh, that's a great question. Thank you for. When we're talking about passing out, there's other things that can be responsible for syncope, fainting spells. In the neck, around the carotid artery, is where we have these baroreceptors. And, the body is an amazing, amazing machine, because there's things that go on, every second of every day where the body's trying to protect itself. And so these baroreceptors are responsible for one thing and one thing only, and that is to make sure and ensure that adequate blood flow gets to the brain. There are a couple organs in the body, the brain being one of them, that the way we were designed is that there's a very highly regulated circulatory system in the body that is in place. So these baroreceptors basically are in some people can be sensitive, and just by pressing on the neck can cause the baroreceptor to fire and cause either dilation or constriction of blood flow. And when I was actually in training, there was a patient that came in that kept passing out, and nobody really was able to uncover why this guy, healthy, athletic kind of a person, kept passing out. Multiple studies were done, and as I was getting the history, I was able to uncover that this guy passed out every time he, was on the bus dressed for work. He was in a suit and tie, and it was just ironic that he was giving that history, and really nobody ever paid attention to that. But what I was able to uncover was that every time he turned his neck, because he didn't really wear a tie often, only when he was, getting, in position for work, I guess, certain days of the week, he would turn. That would press on the baroreceptor. That was a highly sensitive baroreceptor in this gentleman, and he would pass out. And so the message and the moral of the story is that, history taking is so important. So, for me and us as the medical profession, nurses, physicians, medical assistants, physician assistants, nurse practitioners, ER docs, probably the most important part of an assessment of our patient is just listening to what it is that the story is, so that we can put it together, because most of the time the answer is there. On the other flip side, in patients, when we become the patient, and for those listening who are patients, it's important to, give a story and give a good history of what it is you can think of that is happening, in your life at the time. So don't ever underestimate a situation. For example, if we didn't uncover that information, that the guy, that it was happening when he was on the bus and we were talking, then we would have never really gotten the answer. So don't ever hold back or think that it's kind of stupid, or, that you're embarrassed to give, an accurate history, because that is really 90% of making a diagnosis. And that's really very, very important. I know we have some questions coming up, but I want to share with you a couple more studies that just came out. Anti-inflammatory medicines, Advil, ibuprofen, Aleve, those are considered non-steroidal anti-inflammatory medicines. There was an alert that was recently released in terms of a study showing that people who are on high blood pressure medication, whatever the blood pressure medication is, predominantly ACE inhibitors and diuretics. So if you happen to be taking a diuretic. If you're on thiazide diuretic or Lasix or aldactone or one of the many different water pills, or if you're on one of the ACE inhibitors that we use for blood pressure, Vasotec, lisinopril, Zestro, Prinavil, there's a whole host of different ACE inhibitor type medicines. The studies show that people who are on those blood pressure medicines, and if they take non-steroidal anti-inflammatory medicines on top of that, like Advil or Aleve, the chance of developing kidney problems is high. There's a higher percentage of developing kidney problems in that patient when they take Advil, Aleve, or non-steroidal anti-inflammatories. So just be aware, even though you can get it over the counter, it potentially can cause problems. And the kidney is something that, again, is highly regulated in the body. There's a lot of blood flow to it, and you've got to protect the kidneys. How do you protect the kidneys? Stay hydrated. You don't want to get dehydrated. If you're engaging in this new year, a strenuous exercise program, a lot of people are now starting exercise programs. Be very, very cautious to make sure that you're hydrated. And don't start too much too fast, because what happens is you can break down muscle. Muscle breaks down, it's a very big molecule. It gets into the bloodstream, and it could potentially, cause some problems at the level of the kidney, which is where blood is filtrated, developing and resulting in something that we call rhabdomyolysis. So the message for those of you listening is, the take-home point of this is, if you see your urine turn color, if you see that your urine is dark, if it looks like tea, if it looks darker than the normal, yellow light color, that is part of the history that you need to make sure that you bring to your doctor, because that can reflect problems happening at the level of the kidney, and it doesn't take a lot for the kidney to shut down and end up, God forbid, on dialysis or something like that. So be very, very careful. Stay hydrated. That's a huge tip and a message for especially this time of year. George, you have a comment?
We do. Minnie, 43 years old, non-smoking female from L.A., type 2 diabetic. She says, I feel regularly like I am dizzy. I have to sit down even at work. I had the flu about 3.5 weeks ago, but now my equilibrium seems to just be totally off.
Okay. Minnie, I'm really glad that you called in to share that. And basically what it sounds like you have is what we call a sequelae to the virus, or some of the symptoms or the residual effects of a viral syndrome that is called labyrinthitis. And there's last week we were talking about the anatomy of the ear, but in the inner ear of the body, there's 3 little bones in there, and that's basically where the equilibrium center is in our body. And for whatever reason, having an upper respiratory type infection causes inflammation, causes some fluid changes in the sinuses and so forth. The eustachian tube, which is the drainage tube from the sinuses that connects the ear, sometimes can get inflamed. Sometimes debris and those kinds of things can occur, and you can develop this vertigo, this kind of sense of, that you feel that the room is spinning, you feel unsteady. Usually that's self-limiting. There's usually not a whole lot to do. Stay hydrated. Make sure that, that you drink lots of fluids with it. There's something over the counter called meclizine or Antivert. People know it by the name of Antivert. What I would recommend is, it is over the counter. It's certainly not, there's not a lot of risk, factors with it. I would try that. Certainly it won't hurt. And you may be amazed at how that tends to help balance the equilibrium, because that's what it sounds like you have. Interestingly, this year we're seeing a lot of people with this upper respiratory that results in this labyrinthitis. It kind of lasts for a few days and then it gets better. So just something to think about.
We have one of our chatters out there that says, MSM, best anti-inflammatory, just not promoted because it's not a patentable drug that the big pharma can make money on.
Let's talk about MSM, because I think that there's a lot that's going to be coming out about MSM here in the future. For those of you listening, MSM is methylsulfonyl-methamine, which is basically a molecule. First of all, it has sulfa. So if anybody is allergic to sulfa, just scratch it right off the bat, because it's not it's not something that you should take if you have an allergy to sulfa. A lot of people don't know that. MSM has been found to be very effective in the animal population as an anti-inflammatory for different ailments and arthritis and those kinds of things. And there's studies now looking at MSM in the human population. I'm familiar with it. I'm not a whole lot familiar with the MSM in terms of, prescribing it. It's just really not state of the art right now in terms of, from a medical perspective. However, I'm hearing a lot about it, and I'm reading a lot about it, and I think it does have some potential. DMSO is something that we as a medical community, it is used in people that have interstitial cystitis. It's actually used to be infused into the bladder. Interstitial cystitis is an inflammation in the bladder, that the cystic duct, actually, not the cystic duct, but the urethra, in particularly women who have interstitial cystitis. DMSO has been found to be used as a topical agent when it's put into the bladder. Very effective as an anti-inflammatory. And MSN now is being looked at and using it as an anti-inflammatory in humans. And I think there's a lot of research that needs to be done. Preliminary studies that I've seen, that I've read, are not that bad. So we'll see. It's just something that, we just have to wait and see.
Let's see, Pete out of Scottsdale, he says, I didn't catch it if you said it. Is it still okay to get the flu shot? I've had it once. Is the shot the same everywhere as well?
Okay, good question, Pete. Yes. If you've not gotten the flu shot, it is not too late to get the flu shot. And probably through the end of January would be, a time up until the end of January where you can still get the flu shot. The flu season lasts through April, sometimes even into the first week of May. So anything that's going to boost your immune system to protect you in that time. It is the same everywhere. And what they do, basically, the CDC, they look at however they do it, they're able to identify the virulence of viruses in the, in our country, and they identify the top 3. And we developed this. It's not a live virus. It's actually a killed virus that is prepared in eggs. So just something while we're talking about the flu shot, if you have an allergy to eggs, you should not, or you should be very cautious about getting the flu shot. Because if you have a bad allergy to eggs, potentially you can get that cross-reactivity and develop a reaction to the flu shot. So that's one population of people that we really don't recommend, get the flu shot. The flu shot is not a live virus. It's a killed virus. What it does is it enhances, and it basically gives the body the ability to develop antibodies against it. And so it's just really boosting the immune system so that we develop these antibodies so that if we do get exposed to it, we have a defense mechanism in place, ready to go, ready to charge it, and get it. Now, does that mean that you're never going to get sick? No, it doesn't. And that's where medicine is not black and white. The intention is to decrease mortality. People die from influenza virus. And if we can do anything to prevent that and protect the body, the flu shot is really intended to do that. It's interesting, people don't really realize, but there's different doses of flu shots. There's the standard dose, which is what we all get, and then there's a high dose flu shot, which is really recommended for people that are at very, very high risk of potentially, developing bad illness and bad outcome if they get sick. In people that are immunocompromised, maybe chronic lung disease, people that maybe have had a lung transplant and they're immunosuppressed and they really don't have an immune system. Those people, if they were to get sick, their chances of dying from a critical severe illness would be higher than a young healthy athlete, for example. So that high dose flu shot is recommended in that population. There's another flu shot that now is out. It's an inhaled nasal spray. And this is the only flu shot that has a live virus. And I got to tell you, I don't have a whole lot of experience with it. I personally would probably never take the inhaled nasal. It's a nasal inhalation, so people that, or have a phobia against getting the flu shot or don't like shots, there's an inhaled nasal spray. The problem is that it's only recommended in people between the ages of 2 years old and 50 years old. So it's not recommended in the elderly, and it's not recommended for younger, children under the age of 2, because it's a live virus. And that's, in that case, the potential of getting sick from the flu shot is higher. And that's why we recommend it in just that, healthy mid-population. And it is there available for people that don't like shots, but it is an inhaled nasal spray. So that's another preparation, I think, that people need to know about. I know we have some calls and some comments, and I don't know, Joe, you have some...
Yeah, we have one out there that says, what is your take on this? Hugh Fudenberg, the world's leading immunogeneticist,
okay,
and 13th most qualified biologist of our time, has nearly 850 papers in peer-reviewed journals. Says if you have 5 consecutive flu shots, you're 10 times more likely to get Alzheimer's.
Okay,
Anything on that?
I really can't comment on that. I can just tell you what the recommended standard of care is right now, and the flu shot is recommended to be given every year. Guillain-Barré is something that is it happens in like 200,000 people, where if you're going to develop a reaction to the flu shot, usually the reaction is immediate. It's an immediate kind of affecting the immune system, and you react to it. People who don't want to get the flu shot, or the whole school of thought, or the camp against flu shots, basically, that's their argument, is that there's some side effects to it. I got to tell you, if that were the case, guaranteed the flu shot would not be mandated and mandatory, nor would the whole medical community mandate it. So I really can't comment. What I do know is that it saves lives, and it is effective, and it is required in a lot of patient populations. For example, the medical community, we have to get the flu shot. We have nurses in hospitals around the valley. For example, if they decide not to get it for whatever reason, they've got to wear a mask, because we know that people who don't get flu shots have a higher incidence of getting sick and transmitting it to our patients.
What would be a reason not to get the flu shot? A pregnancy?
No. If you're pregnant, that's one of the high risks.
Oh, wow.
You definitely want to get it if you're pregnant. If somebody, for example, like we said, has an allergy to eggs, they don't want to get it. If some people have, there's in that school of thought, MS has been talked about, multiple sclerosis and some of the other neuromuscular type problems, Alzheimer's, dementia. I don't know that that's a reason not to get it. It's just one of those things that if you don't feel comfortable with, then by all means don't get it. But I do know that the medical evidence, the evidence-based literature, is in favor of it, because it absolutely saves lives, period. And that's what we're here to do, is to save lives, is to mass protect as many people as we can against epidemics, and those kinds of things. There's a whole population of people who don't immunize their children.
The conspiracy theory people, right?
Well, I mean, it's not, there's no bad or good. It's just, it is what it is. And when you look at the evidence-based medicine, you can either choose to be part of it, or you can choose to, step out of it. There are side effects either way, and it's just a matter of weighing the benefit and the risk of not getting it. Purely it's your call. It's really, we're not mandating anybody to get it. Who's mandated are the medical people. We have to get it, because we want to protect our patients.
When you're exposed all the time.
Exactly. And so that's kind of, if I have a patient that says, I don't want to get it, no problem. I don't push it. We can't make people get what they don't feel comfortable getting. It's just those people that would have a bad outcome and a bad side effect. So I don't push that on anybody. We can only present what is recommended.
Teddy from Apache Junction, Arizona says, how do you know if you have the whooping cough or the flu? I've got a really serious cough. Sorry if this is a dumb question.
No, that's not a dumb question. You really don't. And the way to, whooping cough usually is related to the H influenza or a bacteria. So, how to know would be to, get tested and see your doctor, make sure that if a chest x-ray is needed, that be done. There's some other antibodies and blood tests that can be done to see. For the most part, your garden variety flu, upper respiratory infection, that kind of thing, sometimes sinus infection that turns into this chronic cough, needs to be treated with antibiotics. And so more and more you'll see that we treat patients with antibiotics. Even though you think that it's probably a virus, a lot of times you can have a super infection on top of it, of a bacteria, strep, staph, those kinds of things. And you want to make sure that you treat that because you don't want it to lead into, other pneumonias and those kinds of things. So there's really no way that you can tell just, where you're at. I think you just need to talk to your doctor.
Crystal from Sedona says, I did not have a flu shot, and I don't know if I have the flu, but for 4 days I've had fevers, and I'm hot and cold and hot and cold, and I just feel really crummy. Should I go and see a doc, or should I see if it'll run its course?
That's a really good question. I think most likely it's probably going to run its course. A couple things that I want to give you to just keep in mind. And when I would recommend that you seek medical help would be if you feel short of breath. If you're feeling coughing and it just doesn't get better, and you get to the point where you get up to walk to the refrigerator to get a glass of water and you can't breathe, that's the time to get in to see your doctor. Fevers, we can have fluctuating fevers. That's just the body's way of regulating itself. So just because you have fevers doesn't necessarily mean that you should run to the emergency room. So I think I would probably give it 3 days, 4 days. After 3 or 4 days, if you're still really feeling bad, it probably would be a good idea to be seen. Especially because by then, if you're not taking lots of fluids, you may be dehydrated. Get an X-ray, make sure it's not turning into pneumonia. Those are the things that I would look at. Night sweats. We don't realize how much fluid we lose with fever and sweats. And that would be another reason to be seen by your doctor. But my rule of thumb is, 3-4 days, I tell you how I would treat myself or my family. If I get sick and, I'm in bed for a couple of days, I don't run to the ER. You just kind of wait it out. But the things to look for would be if you can't breathe, if your throat, is raw to where you can't swallow, that's a huge reason to get in to see an ER doc or call your doctor. Because strep throat is something that's very real that can turn into pneumonia. And when you have strep, which is a bacteria, it needs to be treated by an antibiotic. And so, those are the kind of things. What I would do in the meantime, decongestants are fine to use. Again, lots of fluids, important. Tylenol for the fever, within reason. You don't want to overdo it. If you do have some other medical problems, diabetes, those kinds of things, you may want to be seen by your doctor sooner rather than later. And those are the kind of things. The other thing is when people are sick with the flu, a lot of times you just have no energy, you don't want to get up and move. The best thing that you can do is to get up and move, not to stay in bed all day. And I'm not saying to go out and walk around the block, but I'm saying don't lay in bed all day, because by laying in bed all day, basically you're not going to be taking deep breaths, and that in and of itself is going to set you up for what we call atelectasis. Not a whole lot of air movement in the lung, and it can set you up for like pneumonia, blood clots, those kinds of things. So movement is very, very important. Get up, get yourself out of bed, get a cup of tea, eat, try to keep yourself hydrated, and Tylenol, for the aches and the fever and those kinds of things. And if it doesn't get better, get in to see a doc. I think that's probably the best advice. We were talking about MSN. Joe had asked just before the show about something called chia seeds, and I want to just kind of talk a little bit about that for a minute, because there's a lot of talk. Andrew Weil out of Tucson is doing some lectures and some papers about the chia seed. I don't know if you remember, there was something called the chia pet, but the chia seed basically is very rich. It's a seed, and it comes from the mint family, which is interesting. It is edible. And it's very, very high in omega-3 fats. And so, this whole new anti-aging mindset as we move into, the future here, there's going to be a lot of different things that are going to be coming out that are natural that, have been found to be very, very effective in helping to slow down the aging process. Omega-3 fats is one of them. And the chia seed is something that has really been found to show some positive benefit for the body. It's high in fiber. It grows in Mexico. And one of the things that I think is really very interesting is they're starting to use the chia seed, they're emulsifying the chia seed, and they're adding it in infant formula and those kinds of things so that it increases the omega-3 fats in the formula. They're actually using it also in chicken feed. People who raise chickens, for example, they're feeding them chia seed because what has been found is that it tends to increase the omega-3 fats to enrich the eggs from the chicken. And I think that's just a really interesting piece of information. So just kind of keep your ear out and keep your eye on the chia seed as we move into the future, because I think there's some good benefit to that. So just wanted to throw that out there.
Susan from Mesa says, I drink green tea instead of water because of the health benefits. Mm-hmm. Lately I have no energy. I feel a bit down. My urine smells different. Should I be concerned? And is this acceptable instead of water?
Okay, actually, green tea is great. I don't want you to take away my comment that green tea is not good, but nothing replaces water in the body. We have to, especially living here in the desert. Susan, I would not recommend that you substitute anything for water. We should get at least 6 to 8 glasses of water a day, especially if you're feeling down. And then on top of that, if you feel that your urine is darker, there's a malodorous smell to it, it's important to keep hydrated. And how the body works, again, it's amazing. But water is something that our body is made up of H2O predominantly. And so nothing really takes the place of water. And so that's very, very important. Now, does that mean not to drink anything else? No, it doesn't. Tea is great. Antioxidant effect of tea is really very, very good. But don't substitute that for water. Just use it in addition to. Especially now that you have noticed that there's some issues with the urine. You may need to get your urine checked just to make sure that there's no urinary tract infection. There are certain things that we eat that can cause the urine to smell. Like, for example, asparagus. I don't know if you think about it, but now that on DocTalk, as you're listening, next time you eat asparagus, and the next time you urinate, notice. I mean, there's an odor that comes out of it. That's a normal, byproduct of it. That's the way that the body degrades it. When you take multivitamins, high in B complex, you may notice that your urine is very, very bright yellow, for example. It's just the body metabolizing it. It's not a bad thing, but you've got to have enough water to flush through intracellularly, extracellularly, that maybe other beverages and so forth, really can't do.
Mark from Minneapolis, Minnesota says, I'm a former alcoholic of 33 years. Now I'm 57 years old. Is there something I can do to heal the damage from the alcohol?
That's a great question, Mark. Thanks for calling. Let's talk about alcohol first of all. How alcohol affects the body, many, many ways. Number one, alcohol is toxic to the liver. And so people can develop alcoholic hepatitis, liver issues from alcohol. The long-term effects of alcohol, if you end up having long-term effects, can be alcoholic liver cirrhosis. So that's one thing that a lot of times, there's a reversible component to that. My question is, I don't know if you've never been diagnosed with that, chances are, now that, you're off of alcohol, your body may have recovered and that's great. Alcohol can weaken the heart muscle. So that would be the other thing to see. Is that something that you've experienced? When that happens, a lot of times it's reversible. When you're drinking alcohol, in the time of indulging, it can tend to weaken the heart muscle. When you stop, a lot of times the body tends to reverse, and you can go back to a fairly normal heart muscle function in some people. Sometimes it can be long term, depending on the extent and the duration of the alcoholism. Alcohol can suppress the bone marrow. I see patients all the time who have decreased blood cells, white blood cells, red blood cells, and platelets. And what happens is, over time, alcohol causes kind of this, it suppresses the bone marrow from being able to make new cells. And a lot of times it's based on, being deficient in different nutrients and those kinds of things. But we know that occurs. My question would be, how is the platelet count? Do you notice, bruising easily? Do you have little red marks, pinpoint what we call petechiae on the skin? Do you have what we call spider angiomas on the skin, where just under the skin is thin, and it looks like little blood vessels that kind of spidering out? That's an effect of alcohol, or potentially can be an effect of alcohol, particularly alcoholic liver disease. So those are some of the things that I would question. Now, what can you do to maybe reverse all of that? Or, if you've never been diagnosed with anything, what can you do now to protect your body? Probably the two two things. Number one, make sure that you supplement with folic acid and thiamine. A multivitamin is probably a good idea to make sure that you have folic acid in particular as a nutrient that oftentimes is deficient in people who drink alcohol. So that is absolutely, I think, mandatory to make sure that you have supplementation, nutritional supplements, eat a well-balanced diet. I would avoid Tylenol. I would avoid the anti-inflammatory medications if possible because that can be toxic to the liver. So that's something, as well. And the next thing is, try to stay hydrated and get rest. Try to protect the body as much as you can from an immune standpoint, because that's how alcohol tears the body down. So those are just a couple of things that you can, that might be worth thinking about.
Lily from Detroit, Michigan would like to know, are there any supplements or anything at all that you recommend people to take on a daily basis? And she says, thank you so much for doing such a great show.
Thank you. Actually, yeah, I mean, it really depends on age, and we can kind of go through that. Calcium supplements, calcium and vitamin D, absolutely important. There are more people now that are diagnosed with vitamin D deficiency than ever. And I'm not sure, we probably didn't look for it as much before. Not sure, really what the reason is, but we do know that there's a lot of vitamin D deficiency. Lack of sunlight this time of the year, especially on the East Coast, and SADS, that this seasonal affective disorder. You don't see the sunlight for for months on end. There's a deficiency of vitamin D. So my recommendation is supplementation with calcium vitamin D, as long as there's no contraindication. For example, make sure that you don't have a history of high calcium or parathyroid hormone problems, those kinds of things. But in general, that would be a recommendation. A multivitamin. In particular, antioxidants are very, very beneficial for the body. I can tell you that multivitamins now are in the past, we used to say that it's good to take multivitamins, probably not a bad idea. Now I can tell you that it's actually prescribed for certain medical conditions. For example, people that have macular degeneration, age-related macular degeneration of the eye, it is prescribed to take antioxidants, multivitamins, green leafy vegetables, fruits and vegetables are part of not only to maintain wellness, but actually as a part of the therapeutic treatment to slow down the process of this pathophysiology and this disease process. So that would be my recommendation. This time of the year, vitamin C, probably not a bad idea. So I guess the short answer would be I would take a multivitamin. Calcium supplementation would be good. If your multivitamin has it, that's great. The things that you want to be cautious of are, in particular, the fat-soluble vitamins, vitamin A, D, E, and K. And those are the ones that you potentially can overdose on. And so, just be cautious and be aware that, you're not just taking too much vitamin A, for example. Okay. You don't want to overdo it with vitamin D, even though it's important to take 400 international units up to 800 international units in people that are just, taking it for maintenance is recommended. People who have low vitamin D levels, sometimes you can take 30,000 international units might be recommended. So it just depends. I would recommend talking to your doctor to find out really what that dose is. Number one, is it a deficiency or is it just a maintenance kind of a dose? And that's important. And while we're talking about vitamin D, some of the symptoms can be just muscle aches. We hear so much about fatigue and just feeling tired and achy, and you just really can't put your finger on what the problem is. Vitamin D deficiency manifests itself that way. And so, it's really hard to put your finger on, the symptoms of it. So just very vague symptoms like that, fatigue, muscle aches, kind of, joint pain, if you will, could be, simply vitamin D deficiency, and it's a very easy fix.
All right, we have Zelma from Brighton. I believe she said Brighton, Louisiana. Do you recommend the pH-altered water to fend off ailments?
That's a good question. I have not seen a whole lot of research. I wouldn't recommend altering water, period. I think that, let me take a step back and say that it's important to make sure that you're drinking water that is safe, that is clean. I don't drink anything but bottled water. For example, I'm not going to go turn the spigot on and drink water that way. I think it's important to know where your water is coming from. Is there a benefit to spend extra money on pH-altered water? Honestly, I haven't seen any studies where I can recommend that and recommend that you pay for that. I just haven't seen that. It might be, but I'm not really familiar with it.
Dave from Santan Valley would like your take on the colloidal silver.
Colloidal silver, that's a good question. We use colloidal silver from a wound care perspective. So, for example, somebody comes in with diabetic ulcers or burns or wounds. It's used to be, we use it as a topical to help heal the skin. I know that there's some people that that try it and take it, and some theories that show that colloidal silver might be beneficial in taking it. I have not seen any studies. In fact, what I've seen in reference to colloidal silver has been just the opposite. So I'd be very, very careful. People used to use colloidal silver years ago. In fact, it was taken off the market in the 1940s, and then after it was cleaned up and they were able to purify and make a preparation that was actually compatible to ingest, they came back out with it. But from a medical standpoint, I can't see myself ever at this point recommending colloidal silver because I just don't have the research to back it. So I would be very cautious and careful, especially if you have other medical issues. If you have liver problems or kidney problems, diabetes. I mean, we don't know how that's going to affect in the body. So it's just something to be cautious of. The liver, the function of the liver, the liver has over 500, 600 functions in the body. It's really our detoxifying center in the body. And so I would be really cautious of taking anything that is not approved or experimented with in a positive way and has not been found to be adversely affected in the body, because it could ultimately lead to problems with the liver. So just something to think about, especially if you drink alcohol. That's putting an extra burden on the liver, and I really can't comment on that right now.
Dave from Santan Valley says, I use it as a mouthwash and have not been sick in 3 years.
Great. I mean, if you're swishing and spitting, great. I would be careful of swishing and swallowing, because if you swish it and swallow, that may cause you to become sick. Honestly, I don't know. I would be interested, Dave, to see, is there a preparation that's on the market as a mouthwash? Is it something that they're looking at that might be actually benefiting your immune system, helping with mouth care? Because we do know that there's a lot of bacteria in the mouth, and so maybe this is a good thing. I don't know, but I would be cautious of swallowing it.
Yeah, that's a good question. Where do you get it, Dave? I mean, do you get it on the internet, or you get it from this country or another country, or
right? I would just question that. I would be cautious to know that. When we talk about swish and swallow, what comes to mind is thrush, and now. There's a lot of illness. A lot of people are on antibiotics probably this time, even though it's a virus that that's out there. We talked about strep. We talked about being treated for sinus infections and antibiotics. What happens in the body is when you take an antibiotic, it wipes away the bacteria that's causing the infection, but it could also potentially wipe away the good bacteria in the body, the flora that is. We have good bacteria on our skin, in our mouth, in our gut. In our body, that is bacteria that's protective for the body. And so when you take an antibiotic, it's going to wipe out all the bacteria, including the good bacteria. And what happens is there's an overgrowth of yeast. And I'm sure people have heard yeast infections. After taking an antibiotic, a lot of times people, can get yeast infections. In diabetics, yeast infections because the immune system is down.
Males can get yeast infections too?
Absolutely. And a yeast infection could be on the skin, in the groin. Like people talk about jock itch or foot, fungal infections, or actually, well, that would be more fungal infection. But a yeast infection, overgrowth can occur as well. In the mouth. Yeast infection in the mouth looks like a white, patchy appearing coating on the tongue. And the way we treat that is with a swish. It's called nystatin. It's a swish and swallow. And anybody that, if you're out there listening and maybe you're on antibiotics and, after maybe a week, even after you're off of the antibiotics, a week or two, especially in the elderly population, have a hard time swallowing. All of a sudden you just have a hard time, swallowing. You just can't, get the food down. It's common to develop esophageal candidiasis, which is a yeast infection in the back of the throat extending down into the esophagus. And so the way we treat that is with a swish and swallow that really helps to coat not only the mouth, but the esophagus as well. One of the biggest things that as a medical physician hospitalist that I'm kind of excited to find, because it's so easily treated, is when I see a patient who is sick and is getting better, is on antibiotics but can't swallow, and I find that it ends up being esophageal candidiasis. It's like literally within hours the symptoms go away.
I know my mother takes some kind of inhaler and she has to always rinse her mouth out afterwards or she gets very
That's exactly
messed
right.
up.
And that's another great comment, Joe, is people who are on inhaled steroids. It's the steroid that they inhale, it coats the mouth, it gets down into the back of the throat, and steroids suppress it's an immunosuppressant, and you can get an overgrowth of yeast in the mouth. That's why we recommend swishing and washing the mouth out after taking the inhaled steroid. Exactly the same thing. And if by chance, for whatever reason, maybe her immune system is down and a yeast infection occurs in the mouth, we treat it with a topical swish and swallow, 5 to 10 days, and then it's gone. So it really does make a difference.
And just as a follow-up to Dave's comment, he did say, I do swallow it and I make it myself on the colloidal silver. So.
There you go. So that's something that I really can't comment on. So I couldn't write a prescription for that. Joe, do you have any other questions or comments out there?
No, we're right at about the end of our show, too.
We really are. This hour really went pretty fast. I just want to invite our callers to check out our website, DocTalkRadio.com. Joe, did you see the picture of the new RV that we have?
Oh, my God.
Isn't that neat?
It is fantastic. Please, guys, go to DocTalk Radio.
Yeah, actually, right now it's on the Facebook site. But I'll be posting it up on
and that would also be Facebook /DocTalk Radio. Mm-hmm. And check out the new RV, the new mobile DocTalk Radio RV. Yep. It's fantastic.
It really is. It came out great. And the intention is really to use it as I'm going to call it our broadcast mobile medical unit.
Love it.
We really want to reach out. Gilbert Hospital, Florence Hospital at Anthem, is really in tune with reaching out to the community. We want to try to partner with the community, get our patients in and out as quickly as possible. There's no ER wait. This time of year, perfect time to, if you do need to be seen, consider those hospitals, because, I got to tell you, there's some great things going on, and we can get you in and get you treated and take care of you. But we really want to reach out and educate the community, partner with the community. I'm kind of spearheading this little project, and hopefully we'll be doing some remote DocTalk shows in some of the different communities around some of the senior centers, and who knows, maybe we'll do a road trip across the country this year, Joe.
Hey, I'm ready for that. Maybe Italy, you think?
Yeah,
we can end up there?
That sounds really good.
I'm good with that.
Well, that's it. I think that's it. We're going to be, in the next weeks to come, we have some great guests that are going to be joining us. So if you have any topics that you want us to talk about, don't hesitate to send us a message. Let us know, myself, Joe. Check out the website, send us a message. I would love to hear from you so that we can get some specialty physicians on and just kind of keep doing what it is that maybe is helpful for you to hear. Thank you. Awesome. Thank you all for watching and listening. This concludes DocTalk Radio with Dr. Ann Borik. Till next time, I wish you health, wellness, and many blessings. DocTalk Radio is brought to you by Gilbert Hospital and Florence and Anthem Hospitals. Topics discussed are for informational and not intended to substitute advice from your personal physician.